I'm sitting here together with Tobias Weller, head of R&D from Kettenbach, and we're gonna talk about composites. We're gonna talk about bulk fill composites specifically, and we dive a little bit into the bulk fill flowables. Um, Maybe you can give a short introduction on what you do on a regular base. What do you do exactly for Kettenbach?
Yeah, so first of all, thanks for having me.
Yes, of course, of course.
So as head of research and development, we are always interested in producing new products, and we are mainly focusing on, doing what you need as a dentist.
Exactly.
So I know that you have something like a checklist in mind
Mhm.
when thinking about a product, and we try to tick every of these boxes, so to
Yeah.
say.
And now you have been developing, or you have been working on a new product, a bulk fill flowable, which will be the main topic for this interview. Could you explain a little bit more about why should I as a dentist choose for that specific bulk fill flowable?
So our new product, it's called Versalis Bite Flow. So it's a flowable, as you said, bite fill material.
Mm-hmm.
The specialties on it is that we had a huge focus on the scientific background. So all the scientific studies that we've made was the starting point for us to getting good product. So for example, shrinkage forces, dental adhesion, margin quality, things like that, they are which are very important for the clinical outcome,
Mm-hmm.
of course.
Mm-hmm. Yeah, and normally would also be a little bit of my concern because when I think about a bulk fill
Yeah.
material, then I immediately think about different um things that could go wrong. I immediately think about, okay, maybe too much shrinkage, or I think by bad margin quality due to the shrinkage,
Mm.
or a grayish shine through of the material. Um, but first of all, you chose specifically to develop the bulk fill flow, or at least now we talk about the flowable. Why should we choose a flowable over a packable bulk fill? What would be the benefit of it?
So first of all, our flowable is flowable as it's
Yeah.
called, obviously, but it isn't that is not that flowable as a normal or most flowable composites.
So it will, when the patient lies down, it will
Yeah,
not flow in the wrong
that's
direction. Okay.
that's exactly the tick in the box, so to say.
Yes.
Yeah, that was our idea to have a product that is flowable
Mhm.
with the advantages that I can talk later on of a flowable material, but at the same time, it's not coming out of the upper tooth, so
Yeah.
and
Exactly.
placing, for example. Yeah.
Exactly. So once what we saw in the early days when there were new materials coming up, I
Mhm.
will not call any names, but I think we can all imagine the advertisement where they were calling a
Yeah.
self-leveling properties, and that's something that we actually do not want, because the patient is not like horizontal.
Yeah.
It's laying down in a chair, of
It's
course.
more a theoretical concept.
Yes, yeah, exactly. It's a theoretical concept, but in the office, it's
Yeah.
useless. So you would say this material is still maybe very well able to adapt to the margin walls, so where you have the matrix placed. So that's why I personally use a flowable, just to get a very nice adaptation. But this material has it already in there, and it's not that flowable that I have to be afraid of losing shape in like, I would say, in a big sense. So now, of course, I cannot sculpt, but I can more or less adapt where
Exactly.
I want the
Yeah.
material to be.
Yeah, so that's the idea behind the
Okay.
viscosity of this product. So as you said, there are different viscosities. We have these
Mm,
leveling
mhm.
products, the flowable products.
Yeah.
We do have something that is more viscous, as we say, but it's of course not in the range of a sculpted or modellable. And as you already said, these materials, they do have advantages and disadvantages at all.
Mhm.
So for example, for the flowable, as you already said, and due to this flowability, it adapts much easier to the cavity wall. You don't have to do it by hand as
Yeah.
with a scuttable material,
Yeah.
for
Yeah.
example. On the other hand, what we know is that some dentists prefer the flowable ones and some dentists prefer the
Mhm.
packable ones. That's why we are thinking about all viscosities,
Yeah.
so to say.
Yeah.
Yeah.
And I can also imagine the tip normally of a flowable is much more precise. So if you have very difficult areas to reach, I can also imagine that it would be a little bit more easy to apply the material in the correct area, because with a composite compule, sometimes it's very difficult to reach a very narrow space. So I can imagine. But but what about the difference in shrinkage or wear rate? Is there any difference, or if could you explain or inform us a little bit about that?
Yeah, so when talking about a flowable and a packable, the main difference is, of course, the filler content.
Yeah.
So you can get a packable material or sculptable material by
Mhm.
adding. It's an easy concept that I'm just to imagination it. You can add more filler to get from a flowable to a packable.
Yeah.
That's the idea behind it, or that's the easiest way to become a packable from a flowable.
Yeah.
Um, and the higher the filler content, of course, the less is the shrinkage. But that's is once again just more a theoretical part.
Okay.
Not only, but
But that's how my mind would
yeah,
work. So I would say, okay, a flowable has probably higher wear rate and higher shrinkage
yeah.
stress, just because what you explained.
But it's not as easy.
Okay.
Because we are not
Well,
talking.
tell
Yeah,
me, tell me how it
yeah.
works.
So first of all, yeah, we are talking about the fillers, yeah.
Mhm.
But not only about the fillers, but fillers are a very important part in it. So as I said, the higher the filler content, in theory, the less the shrinkage. That's
Mhm.
obvious.
Yeah.
But it's also about, for example, the filler size distribution, first of all.
Mhm.
So depending on the distribution of the fillers, small particles with big particles and so on, you can have, even if it's flowable,
Mhm.
a high filler content, for example.
Okay.
That's one reason why you can have a flowable material, but at the same time a low shrinkage. On the other hand, when talking about fillers and fillers in case of wear, in case of abrasion,
Mhm.
um, you also have to think about how these fillers are coupled with the surrounding resin, the surrounding matrix of the monomers, and later on the polymers. Um, so that's also something very important in case of abrasion.
Mhm.
And what's even what is almost most important, so to say, is the monomer matrix itself.
Mhm.
So even if you do have, let's say, a monomer content of 30% because the rest is the filler,
Mhm. Mhm.
this is the main part that is, of course, reasoning the shrinkage.
Exactly. Yeah.
So it strongly depends on what you are mixing together. It strongly depends on the mixing or the composition of the monomers, and that's yeah the main part that you have to focus
It's
to.
because how the links between the monomers are actually formed that will induce the amount of shrinkage. And
Exactly.
because normally when and we already I think when you have a material with a low shrinkage,
Mhm.
then I can imagine that there is from the monomers there are already like some polymers formed more or less, so that you have some of the monomers already coupled, but then that will sometimes reduce your working time under normal lighting conditions. So that will mean that they already starts to
Mm.
pre-cure a little bit when you have your normal lights on the composite, because already some parts are pre-cured. But you and Kettenbach, you developed a little bit of a different technique, right, to reduce the shrinkage. Could you explain a little bit more?
So you're totally right. Some competitor materials, for example,
Yeah.
they do have these pre-polymers in it. So pre-polymerized monomers to lower the shrinkage.
Yes.
In theory, it's possible. We do not. We didn't go that way.
Okay.
So we were really focusing on the monomer matrix,
Mhm.
and it's, as you said, it's the shrinkage is, let's call it, always the same. So you do have this groups in it, and then do shrink. Yeah.
Mhm.
But of course, it depends on the length of the monomers.
Mhm.
So the longer the monomers, the less
Mhm.
polymerization groups are in the product. So the
Yeah.
shrinkage is less.
Yeah.
And on the other hand, it's also depending on how these monomers look like on the chemical point of view.
Okay.
So if they do absorb somehow the stress, then you maybe
Mhm.
in some cases you do get a shrinkage, a volumetric shrinkage.
You mean that it's within the shape of the molecule that they have some room to extend more
For
or less,
example,
something
yeah,
like that? So they
or
don't pull
something.
everything together, but they're able to stretch a little bit.
Yeah,
Like,
or they are elastic, or they are
uh-huh.
stacking, for example, in a chemical way that they do have a separation. Just
Uh-huh.
as an
I
example,
see.
between
Never
one.
thought about that, but makes sense.
Yeah.
Yes, of course.
And okay, then you maybe you can still have a volumetric shrinkage because
Mhm.
that's
Mhm.
always the
Mhm.
case.
Yeah.
But more important is the shrinkage force that applies due to this
Exactly.
volumetric shrinkage.
Exactly. And that way you can keep the shrinkage force pretty low. So there will be shrinkage, but if it's
Exactly.
bonded to the cavity walls, then it will be less force on that bond what you already applied.
Exactly. So you need this low shrinkage force, so
Mhm.
not that much force on the cavity to separate it,
Yeah.
but a high adhesion force.
Uh-huh.
And then you get a nicely product.
Okay. Well, it sounds promising, of course. And could you maybe explain? Because what I found is that the material is not as grayish as I sometimes experience with
Mhm.
other materials, because that would be a reason for me not to use a bulk fill, because I don't like the transparent look, and in the end then my composite restoration looks
Mm.
pretty grayish. How did you manage to still keep that 4 millimeters increment that I can place and still have a good light cure, but have a material that is really absorbing the color from the
Yeah.
tooth itself?
So besides the shrinkage problems, this is the
Mhm.
other main challenge
Yes,
of
yeah,
such a
yeah.
product, of course, because you want to have, as you said, by with a bulk flow material or bulk material in
Mhm.
general,
Yeah,
at least 4 millimeters of polymerization there.
yeah.
But at the same time, when placing 4 millimeters, you do not want to have it grayish. You do not want to have it too much transparent. You need
Yep.
a certain transparency to light cure it, but you do not want to have it, yeah, in your final restoration, so to say. It shall be very transparent to get polymerization, but not um, transparent when it's in the patient's mouth.
Exactly, because otherwise I need to get a regular composite and cover then my bulk fill with a regular
Exactly.
composite in order to have its
Yeah.
somehow aesthetics. And of course, in the very posterior teeth, I mean that most of the time is not that much of an issue. But when you have an MOD or an M on a premolar, you can see the grayish sometimes shining on the contact area. And when someone is smiling, that should be aesthetic.
Yeah, and another case where where this grayish is even coming more into focus is if you have a, for example, the metal crown,
Ah,
master
yes, yes.
restoration.
Or yes,
Then it's keep grayish and grayish, and yeah, that's another point. So what we did
Mhm,
is, so first of all, it's once again the filler technology.
mhm.
So depending on the fillers and how the fillers and the monomers are matching together to their refractive index, they are at the beginning on the same level. Then you polymerize them, and then they are somehow separating. So the refractive indices are separating due to the polymerization.
Mhm,
So a polymerized monomer has a
mhm,
higher refractive index
mhm, mhm.
than the non-polymerized monomer. And
Okay.
that's what you can make advantage of by using this technique to get a transparent material at the beginning, light
Yes.
cure it, and then it's getting opaque.
So you would say that during the light cure, it's more transparent, and or before the light cure, and when it starts light curing, refractive index change, and you then change the transparency of the material.
It can be, yeah, exactly. Yeah,
Okay.
that's one of the idea. When you're preparing monomers and fillers and put them together, they somehow do need to, yeah, fix with each other, match each
Yeah.
other, so to say.
Yeah, yeah.
Yeah,
Well,
that's one idea.
and that is and there is another one. I sense that I taste a
Yeah.
little bit with your answer. There is also another solution. Well,
So
another technique that you use.
yeah. So normally, if you have a product and you want to adjust the color, so you always have to somehow adjust the
Mm-hmm.
color to the reader standard, for example, or
Yeah.
to the normal tooth color, so to say. Then you are putting pigments inside of it.
Mm-hmm.
If you are using very white pigments, the normal ones, so to say, the classical ones,
Yeah.
they do have a very white, yeah, um, appearance, so to
Mm-hmm.
say,
Mm-hmm. Very opaque.
very opaque, very white, and then you are getting, yeah, very much influence on the polymerization depth. So you're
Mm-hmm.
getting a product that is more opaque, but
Mm-hmm.
much less in polymerization depth.
Yes.
So we are focusing also on this, let's call it
Mm-hmm.
pigmentation technology, so to say. Um, by adjusting it with pigments, they are not that whitish, so to say, not that
Yep.
white in color.
Yeah.
And also due to the particle size, once again, of these ones. So if you do have smaller particles, then you do not have, in theory, that much fraction of the light. So
Okay.
you do get a nice color
Mm-hmm.
by these pigments, but you do not lose that much of polymerization depth.
I
And
see.
that's the trick to get 4 millimeters in polymerization, but at the
Yeah.
same time, a quite opaque product
Okay.
for a bike material.
Okay. Well, that sounds very, very clever, actually, to come up with something like that. And we already talked a little bit about filler particles, because I think for filler particles is important for wear resistance.
Yeah.
So if you look into, of course, we want a material that is not more abrasive to the opponent antagonist teeth, so the opponent. So it should not wear the enamel, but on the other hand, it should not wear as fast as some of in
Some
terms
of
of the
the
composite,
itself, yeah.
it should somehow be durable.
Mhm.
On the other hand, my experience is that when a composite is more durable and more wear resistant, it's much harder to polish. How did you? Because I feel this material is kind of very easy to
Yes.
polish. How can I then still trust it's wear resistant while it's so easy to polish?
So in some points you're right, it's once again a bit more difficult. Sorry, something
I'm too easy.
Yeah,
I think a little bit too easy about it. Yeah.
I need to be more complicated.
Yeah.
To develop it. You don't need to be that complicated
Yeah.
for applying it.
Yeah.
So in this case, we are talking. So the polishability is, for example, very bad if you do have very large particles, because then the
Yes.
larger particles are,
Exactly.
of course, getting out. And
Yeah.
at the same time, this can also be a reason for high abrasion, for high wear. If you do
Okay.
always lose a very big particle,
Yeah.
then you, of course, get so much wear.
Yeah.
But it's not only, once again, not only the particle itself and the particle size, but it's also the coupling. If they are very nicely coupled, or coupled inside the resin matrix,
Yeah.
you do have, of course, less wear, which is obvious because it's resisting wear.
Okay.
So what do you need? Do you need a very nice?
Would you then also mean an adhesion between the matrix and the filler particles? That would also play a role then, I guess, right? I mean, the better the particles are glued
Yes.
together, the more resistant it is.
So normally you really try to chemically bond the filler particles to the resin matrix by applying, for example, monomer or monomer groups on top of the particles, and they are connected to the monomers of the resin matrix, so to the surrounding matrix, and they are very nicely coupled together.
Okay.
And they do have, due to this reason, a nice wear resistance, for example. Coming to the polishability of the same material, so they are nicely coupled, but then you need to have particle size distribution that is not too big. So if you polish it, it needs to stay in a very rough, no, in a very
smooth.
smooth.
Yeah. Because of the small
Exactly.
particle size.
You want to avoid roughness. That's the right way to say it.
Yeah.
So you can nicely polish it, and at the same time, due to the nice coupling of the material in the surrounding matrix, you do have a very low wear or abrasion in this case.
I see. And what about a completely other part of but still important with composites, is more about the biological idea of composites. I mean, we know composites are not biological, but there are some issues with BPA. There are some issues with some of the monomers. How do you deal with this product about concerns that some of the patients or even I as a clinician do have on a daily basis?
So first of all, yeah, you're totally right. These monomers are not that biologically, friendly, let's say. Yeah, let's call it like that. But you always have to make sure that your material is biocompatible. And you can be biocompatible on a low level or on a high level. We try to be, in this case, once again, be on a high level. How? So first of all, we are avoiding, for example, this GMA. We are avoiding, and not only avoiding, we do not use them. We do not use bis GMA. We do not use BPA derivatives. So it's
Because this GMA, if I'm correct me if I'm wrong, but as I understood is that the bis GMA as a byproduct may sometimes contain BPA, or even as a breakdown product could release somehow a little bit of BPA. That's right?
Exactly. Both things are possible.
Okay.
So due to the production process, they have to use BPA to get the structure in the
So could you then also say that this composite is BPA free? Is that like okay?
So it doesn't contain any kind of BPA derivatives. So no monomer that contains BPA or that is made out of BPA.
Okay.
Where you can have residues of the BPA monomer.
Okay.
Or not BPA monomer, but BPA molecule in this case.
Yes, exactly.
Yeah. And on the other hand, we are also avoiding, in this case, HEMA and Tech DMA. So also, once again, two molecules or two metacrilates, they are not that nice.
Like I say, they are well known.
Yeah, exactly. Yeah, it's due to their water solubility.
Yes,
and if
high penetration capacities and
the smaller the molecule and the more water soluble, then it's worse for the patient.
okay. Well, is that where do you think that, because I'm always think a little bit about the future, where do you think that new developments, of course, we can see here new development of composite materials, but it's still the same kind of
Mhm.
basis for the material. Could you maybe walk us a little bit through in what you think the future will bring us for restorative materials? What will be a next step in development? What will be a next step for Kettenbach as a restorative material? What can we expect within 2 or 3 years?
So we are more and more thinking. So once again, we were talking about the viscosities,
Yes.
and I told you that we have exactly this viscosity that we find very beneficial.
Mm-hmm.
But
Yep.
we are also thinking about doing other ways of viscosities. That's just yeah.
Okay, so
That we
maybe
have in
maybe
mind.
a little bit higher flow or
Maybe
less.
higher or lower. So it's,
Okay.
as I said, there are advantages and disadvantages, and we very like our viscosity. But some dentists, they prefer, for example, a packable, and in some situations, it's yeah
Yeah. Yeah. Well, of
as
course,
easy
that would make
to
sense.
apply.
Yeah. Yeah.
So maybe we are going to other viscosities, for example. Another example would be to be more digital on a
Mm-hmm.
way,
Mm-hmm.
because in some cases you do not really need to do it. Do it with a filling material itself, or
Yeah.
filling a
Exactly.
cavity.
Yeah. Yeah.
So nowadays, I think the digital density is a part where
Where we go. Yeah, yeah. Okay.
all
Well,
parts are brought. Yeah.
I'm very curious to see how these developments will go on. I'm very enthusiastic about the bulk fill flowable Physalis bulk fill flowable, and I think these are very nice developments where we can see. Of course, there were already bulk fill materials on the market, but you brought it to another level. You brought it to the next level where we are not afraid of the grayish shine through. We are not afraid of the shrinkage, and we can with confidence know about the wear rates, wear resistance, and the ease of polishability. So I'm really looking forward in using the material on a daily basis. And I would like to thank you very much for your time and your explanations regarding this topic. Thank you.
Thank you very much.